Meet Kelechi, an 8-year-old boy full of curiosity. He and his family of 5 lived in a one-room apartment and shared a single pit toilet and bathroom with 14 other families. The neighborhood was waterlogged, a breeding ground for disease-carrying mosquitoes. Water pipes would break all the time, allowing dirt to contaminate clean water, causing an outbreak of cholera that almost killed Kelechi's father. 300 others died at a point. He had already mourned 3 friends. Confusion overwhelmed him as he grappled with the notion that death might come for him too. As he got older, he realized his friends had died from diseases like cholera, diarrhea, malaria, and typhoid. This tragic cycle of suffering continued, and nearly every household in his neighborhood losing at least one child. These are the memories of my childhood. Kelechi was my grandmother's special name for me. My name is Chris Chukwunyere. I am a 2023 Information Futures Fellow at the Brown University School of Public Health, USA. In my country, Nigeria, 1 of every 8 children never celebrate their 5th birthday. Nigeria bears the greatest burden of malaria worldwide, accounting for approximately 51 million cases and 207,000 deaths annually. In 2022, Nigeria lost close to 5,000 people to infectious diseases such as cholera, Lassa fever, yellow fever, meningitis, and COVID-19 alone. But it is not just infectious diseases strengthening Nigerian lives. About 1/3 of the adult population suffer from hypertension, and there is a growing prevalence for other non-communicable diseases such as diabetes and various cancers. However, it is not all doom and gloom. Nigeria has an amazing resource of vibrant young people who make up 70% of the population. That is, 140 million people under the age of 30. If properly channeled, the energy, creativity, and vigor of these young people can be harnessed to create incredible social impact. This is why my project aimed to leverage the power of the Nigerian youth to help improve the health of people in our communities. I identified and recruited 40 young people who share my passion for creating change. Then I collaborated with subject matter experts to equip these young influencers with knowledge, skills, and resources to become effective social impact leaders. Let me introduce you to one of these remarkable young people. Meet Peace Odunayo, a 23-year-old student at the University of Jos in Plateau State. Peace, although not living with a disability, resides in a hostel along with other students living with disabilities. Having witnessed the vulnerabilities and difficulties encountered by people living with disabilities trying to manage their health and access health care, Peace is determined to contribute to making things a little easier. Peace is one of the 40 young people we identified and trained to become credible messengers to 40 rural and semi-urban communities, including the internally displaced persons camps across north-central Nigeria. Together, we conducted community health needs assessment in these communities, analyzed the data, identified information gaps, and organized a design workshop to develop local solutions that addressed those gaps. This workshop yielded over 30 culturally appropriate local solutions driven by these young people. One of the notable solutions we created was Health Info Africa, a mixed method digital platform that provides health information using culturally appropriate messaging. It includes a website, a podcast, YouTube channel, and social media platforms. Through the social media platforms alone, we reached over 100,000 people in just 1 month. Furthermore, I intend to complement this platform with a user-friendly smartphone application to increase access to more people. Through this project, I have demonstrated that young people in Nigeria can contribute to the development of their immediate communities and can engage in advocacy, community mobilization, and collective action for change. The young people I worked with live in rural and semi-urban communities just as I once did. They have first-hand experience of the burden of health inequity, poverty, and disease within their communities, and their experiences inspired their commitment in this project. Reflecting on the past, I believe that the children who died when I was young would still be alive today if their parents had access to health information presented in formats they could understand. Finally, to document my work with these young people and create a resource for the global health community, I have written a handbook titled Youth-Led Community Health Needs Assessment, a 10-step approach. I am grateful to the Information Futures Lab at the Brown University School of Public Health for this opportunity and the support which allowed me to kickstart this project. However, we have developed 30 local solutions that need to be implemented. This is where we need to scale up this project. I look forward to raising the funds to implement these projects, improve our impact while working with these young people. Thank you.